Okay, so the first thing I'm going to do anytime I go into a patient's room, I'm going to knock and introduce myself, and I'm going to tell the patient my name is Kristen and that I'm her nurse today. I will know that she may not be able to verbalize who she is, so I'm going to ask her while I'm washing my hands if her name is Alice, I'm sure is what the patient's name is today. And she's going to nod her head, and I'm going to ask her, is your birth date such and such? She'll nod her head, and I will also check her wristband, and she is Alice. So now that I'm in here, I'm going to make sure that I have checked my doctor's orders over and over and over again, and then rechecked them one more time to see exactly what it is that I'm supposed to be doing with Alice, and then I'm going to explain to her. Right now, all we're going to be doing is suctioning and getting all that. So anytime you are doing anything with the lungs, you'll want to make sure that you have an oximeter. I would put that on her finger to monitor that while we're doing this, and I don't have one, but I have a make-believe one, so that's good enough. And so I would just make sure I brought all my supplies in. I wouldn't have done that either. I would have made sure I brought all my supplies in and just keep what I need at the time on the cupboard or on the table. So I will need this is just for the suction. I've washed my hands, and anytime you do this on a patient, you want to make sure you've got all your suction down here ready to go. And I practiced this on the other side, so this is going to be fun. But the suction's set at what it needs to be at, and then it's running fine. And then you'll want to have your oxygen right here ready to hyperoxygenate the patient before you do this. And you want to make sure that you do that for a full minute before you do any of the suctioning. And then you can just leave it right here, because then it works as a little flow going in there, even though it's not right next to it. So that's going to have been on there for a full minute. And I'm going to come over here. I'm going to make sure I have my trash where it needs to be, so that if I need to throw anything away. Okay, I will open my kit, making sure that I don't touch anything that I don't have to, anywhere that I don't have to. I'm gonna set it like that, and then with this one, just touching it on the very edge, I'm gonna try and slide out that little cup, and come over here with my gloves, and just touch it on the end. I didn't mean to touch it that close to the other part, but it's still sterile, so I'm gonna just touch it only on the edges and come out. And so now I can put on one sterile glove. So I'm just gonna grab it by the cuff. Pretend it's not sticking and that it came off really, really well. Use your imagination. And step back so that it doesn't drop onto my sterile field. Put my glove on. Now I can pop my cup with my sterile glove. And so with that, I wouldn't be shaky at all. I'd be a pro. Seriously. So I would pop my cup here. And all of this has stayed sterile because I didn't touch it on the edge, but this cup's not cooperating. Okay, so you can set that there or you can set it here. So with my unsterile hand, I'm going to open the fluid. So I've done that, and anytime the lid would have come off in real life. Anytime, if it's already been opened, I'm going to just lip it and get that top smegma off. If it's not been opened, I'd want to make sure that I labeled and opened told when I opened it. So I'm just gonna come in here. I don't wanna reach over all my stuff. I just wanna come in here and pour that liquid in here so that I have that to clean out my suctioning when I'm done with that. So now that this is done, and I would not have come over here and I would not have taken my eyes off of my sterile field, then I can put on my other glove, and I would do that with the other hand and come in, and now I've got both of my hands sterile. And more than likely this would have been closer to the time that she's had that full minute of her oxygen, so that she's okay that way. I'm going to just take this out, and I practiced on the opposite side, so I hope this doesn't screw me up. With this, I can take my tube, and I'll want to just wrap it around like so. And once I use this hand to touch that tube, this hand is no longer sterile. And I'm going to want to make sure that when I connect my tube to this one, that nothing else touches either hand. So I'm going to take this and apply it right there, and now I can let go, and I've got my sterile. I would have avoided touching the very tip of this at all costs to make sure that what I'm putting in her hasn't been contaminated. So I would have definitely raised this patient to a semi-Fowler's position, but this bed confuses me. So I would have done that in the beginning. We're gonna pretend that's semi-Fowler's position because I don't know how this bed works. But she would have been up right, and she would be comfortable, oxygenated. I repeat myself, sorry, Cody. Okay, so now I'm going to go in. When I go in, you wanna make sure that that wouldn't have been there, but I would have asked somebody to move that. Okay, so I would go in and I would just keep pushing that in until I hit that bifurcation. She'll gag when it hits that, and once she does that, I'll know to kind of come off of it about an inch. Once that happens, I'm gonna make sure that I don't suction for more than 10 seconds, and when I do that full 10 seconds, when I'm coming out, I'm gonna kind of keep it moving in a circular, rotating that out and coming over here. And this will have been in my line of vision the entire time. I'd come over here and do the same thing over here with the saline and sucking all that gunk out until it gets cleared. You need to make sure that you wait 30 seconds before you do that again. You could monitor her O2 to make sure that that wasn't too much work for her, and if needs be, she can just make sure that that's a little closer to her. So then I'll come in here and I'll do it again, and I will go in, making sure I don't touch any of the nasty, and wait till I hit that, put my thumb over the suction, and no longer than 10 seconds, and then on my way out, doing it in a circular motion, and not touching anything else. Come over here, do the suction. This would have been in my line of vision the entire time. Suck, suck, suck. Make sure that that tube's clear of all that it needs to be. Make sure that it's been 30 seconds before I go in. The last time you should only go 3 times within one process. So I would come in one more time, hit that bifurcation, come off at about an inch, put my thumb over the suction, suck for 10 seconds at the most, come out, and then depending on how her breathing is, I would make sure that, and then I would come over here and suck it one more time in the saline, put it over, get that suction good. Whenever you are done with this part, you obviously want to make sure you know if she's doing good on her oxygen, have that available if she needs it, and then you'll take this and you can just undo it like this, and when you do, you're going to take it off, and I'm going to pretend I'm going to take this off by double gloving it and putting it in a biohazard material, but Cody's going to reuse this, and so I don't want to make it too hard to undo. But it would be crumpled up in my hand, double bagged and not be flopped around like that at all. After you're done with the suctioning, you want to assess all of her breathing and everything there, and you want to, these gloves would have been off, and I could put on some new gloves. Plus I would want to make sure that my stethoscope and my, I have some alcohol wipes for my stethoscope so that I could listen to her, her respiratory sounds after I've gotten done suctioning. Clean it before, clean it after you're done listening with your stethoscope. So you'd have your stethoscope to listen to anything in her, see if there's any residual crap going on or anything like that, and assess all the places on her that you need to for that. Clean your stethoscope again. Make sure that the suction and all the machines are working properly and what they need to be at post suction. Make sure you clean up all of your mess, and you make sure that she's comfortable. Put her in the position that she's supposed to be in. Make sure that she's got her call light, her water, her table. Make sure that she has her oxygen's good. If you've done any other equipment or procedures, then you just go and make sure you document and report anything unusual or not normal, or the success of your suction. And then clean up your area, she's comfortable, and you can go, I think.
On and off.